Meet Audrey. She's a 45-year-old middle school principal who's been exhausted for months. She blamed the job. But then she started getting winded on the stairs, dizzy during the day, and felt her heart race just crossing the parking lot. A simple blood draw explained everything. Let's notice. The defining symptom is fatigue that doesn't improve with sleep. She looks pale, gets dizzy easily, and her symptoms crept in slowly, so she adapted and delayed care. On exam, she's stable, but her heart rate is mildly fast. Hemoglobin is the key lab. Hemoglobin carries oxygen inside red blood cells, and Audrey's value is well below normal. Let's interpret. Anemia is too little hemoglobin to deliver oxygen. When tissues don't get enough oxygen, muscles fatigue, the brain gets dizzy, and the heart speeds up to push more blood per minute. Anemia comes from three big buckets: blood loss, decreased production, or increased destruction of red cells. Audrey's history points to chronic blood loss from months of heavy periods. Hemoglobin depends on iron. With slow, repeated bleeding, iron leaves the body instead of being recycled. The bone marrow keeps working, but without enough iron, it produces smaller, paler red cells. Because this happened gradually, her body partially compensated, masking how severe it became. To respond, first, assess stability. Audrey's vital signs are stable and her hemoglobin is above 7, so transfusion isn't first line. Second, find and stop the bleeding by including gynecologic or gastrointestinal specialists. Third, replace iron so hemoglobin can rise. Finally, supplemental oxygen can help symptoms but doesn't fix the cause. Reflect. If treatment works, her hemoglobin rises, heart rate settles, and the fatigue lifts. If it doesn't, chronic strain can lead to heart failure, or rapid bleeding can cause hypovolemic shock. In summary, anemia is low hemoglobin limiting oxygen delivery. Fatigue is the classic symptom. Treatment targets the cause, replaces what's missing to increase production, and reserves transfusion for instability or hemoglobin less than 7. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.